This is our new post-anesthesia care unit, or PACU. One of the things that I discovered in designing a children's hospital operating room is that you need to have a PACU or recovery room that's 2 or 3 times a normal PACU. That's because we have to anesthetize children for just about everything. Kids have to be anesthetized. They have their kidneys. They have to be anesthetized. They have CT scans. They have MRIs. So you have to build a PACU or a recovery room to take care of all these people. So although we only have 16 operating rooms, we have 54 PACUs. We're continuing to grow. So we are currently the busiest children's hospital operating room, actually at West of Texas Children's. So an extremely busy operating room, extremely busy service. I'm going to walk you through some of the current surgery we're doing at Children's. And I think everybody's done eating. I promise not to gross anybody out here. But this is something called craniosynostosis. Craniosynostosis is where the bones in the skull tend to form together too soon. So you can see these are the central area right here. The bone is not fused across. And the one on the right, the bone is actually fused across, so it's an early fusing of the bone. What that does is that in these kids, they end up having basically this shape of the skull on the right, which almost looks like a football, which is just, it not only causes cosmetic problems, but can actually cause problems with the way the brain develops. We've been integrally involved with a software and hardware company in San Diego developing a 3-dimensional camera system that allows us to operate on these endoscopically. And this is one of our neurosurgeons who we have to wear this. This is sort of like the 3D glasses. We have to wear this to do the procedure. I told him that would be excellent birth control. Nobody would ever want to be wearing that outside the operating room. And what ends up happening is in order to do these procedures in the past, you would have to make an incision across the skull over here, and then peel down the skin here on both sides, and actually cut the bone, remove the bone. It's sort of like a jigsaw puzzle, putting it back together. Using this new technique, we're actually able to do this through very tiny incisions, and as crazy as it sounds, the bone is about the caliber of cardboard at this age. So you can actually use scissors to incise the bone using this 3-dimensional camera, and you can do this entire procedure through a couple of very tiny incisions. So we're the leading institution right now in the country of doing these, and by doing these procedures endoscopically, we are able to save a tremendous amount of misery for the kid, and when he ends up with a hairline like mine, you don't see the scar. And this is an endoscopic view. Basically, this is brain down here, below here, and what they're doing is they're dissecting brain off of the skull in order to make the incision in the skull. Using the 3-dimensional camera allows them to have a better idea of where they are at all times. And this is a satisfied customer. So this is something that's going to be near and dear to Barry's heart, and he's going to tell me, oh, you don't really know what you're talking about here. But basically, we have become one of the centers for scarless surgery. And as a surgeon, I know there's no scarless surgery. Basically, what it means is we're able to hide the scar. Everybody knows this is what a belly button is. Belly buttons are a great place to hide scars. This is what an appendectomy scar looks like in somebody who was done many years ago. And nowadays, we can do them endoscopically through the belly button. The neat part is now we've got the equipment and the ability to do procedures that normally would have required extensive incisions in the past. And our surgeons now, in addition to doing appendectomies, have done colectomies, they've actually done gallbladder removals, all through this very tiny incision using instrumentation. You've got to remember you're doing this in a child too, so a lot of the surgery has been done in adults for some time. We're doing this in children, so very tiny space that this is occurring. And this is post-op. And another satisfying test. One of the things our adult surgeons over at UCSD have been proposing is something called NOTES. And NOTES is natural orifice endoluminal surgery. What this means is rather than making any incisions outside, you actually make incisions inside. So if you can imagine putting an endoscope in, making an incision in the wall of the stomach, and then entering the abdominal cavity, in this instance, to remove the gallbladder. This is not being done in kids yet, but it is being done in adults. And most recently, the rumor has it that the coach of the San Diego Chargers had his appendix removed here. Some people were claiming he had also had something else removed, considering how he did last year. But he did have his appendix removed and did well. So this is a lot of work to keep from having an external scar, but it is perhaps the future of surgery. Okay, so as far as the future is concerned, I'd like to talk briefly about what's going on in the hospital in San Diego. Over the last few years, the University of California at San Diego and Rady Children's have gotten closer and closer. Probably 12 years ago, they became amalgamated. About 3 years ago, we created a medical practice foundation so that everyone in the hospital is on faculty at UCSD, and we're integrally involved. It was a terrific opportunity for the hospital because UCSD is internationally renowned for research. It's one of the top 30 research institutions in the world, and a pretty exciting place right now. The hospital has just invested in a new Discovery Institute. This is a very large building which is actually on our campus, which is specifically for both wet and dry lab research. And it's a pretty exciting time for the hospital to be entering research because of all the things that are actually